Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Peace is a rare commodity in our often turbulent world. Yet, who would not love to find peace? Peace of mind, peaceful emotions, and a peaceful soul. Mission Evolution Radio TV show is coming to you around the world on the X Zone broadcast network, xzbn.net. Joining us this hour to share his insights on achieving inner peace is Bruno Cayoun, the author of the Mindfulness and Meditation Workbook for Anxiety and Depression. Balance emotions, overcome intrusive thoughts, and find peace using Mindfulness-integrated CBT. Dr. Cayoun is a clinical research psychologist and a developer of mindfulness-integrated cognitive behavior therapy. He's the founder and director of the MiCBT Institute, providing MiCBT training to mental health professionals internationally. Dr. Cayoun is the clinic director at Macquarie Psychology in Australia and undertakes influential mindfulness research. He's the author and co-author of 5 books and scientific articles. Bruno has been practicing mindfulness meditation since 1989. His website, mindfulness.net.au. Bruno, thanks so much for joining us on Mission Evolution.
Thank you, Gwilda, and very grateful for the opportunity to share a little bit of my knowledge.
Oh, we're so glad to have you. Now, you're in Australia, aren't you?
Yes, in the state of Tasmania in particular.
Amazing.
Very tiny little state at the bottom of the country.
So, as a clinical and research psychologist, how did you become involved in mindfulness?
So basically, in my travels in the 1980s, I ended up in Asia, Southeast Asia in particular, and discovered meditation, yoga, and I really, really embraced Buddhist teachings in particular, and in particularly the meditation it teaches. So this was the beginning for me.
So,
And of course, it brought a very strong interest for psychology because of the overlap between the two.
so how do they overlap? One seems mystical, and the other one seems like a medicine, basically.
Of course, the overlap lies in the practicality and the transformation that one can experience within their own thinking. I mean, there is spirituality which is based on faith, and spirituality that extends to one's behavior and the experience that this has on one's life, transformative experience. And I was very interested in this. So, of course, there was a profound psychological mechanism involved in mindfulness training, except it often starts, or as we understand it in psychology, from the bottom up, from the direct experience up towards the understanding of how nature manifests itself within and without. So, whereas more a faith-based approach is more a top-down approach. When we work out things, we rationalize certain things, we believe certain things, and of course, it affects us in different ways. So, but I really appreciated the direct experience approach.
So, what is mindfulness? So we're all on the same page.
Yes, indeed. Mindfulness has been passed on for 25 and a half centuries now from the originator, if you like, of those kind of teachings, the Buddha in northern India. And then, of course, it's been preserved over that time, but different congregations of monastics have taken their little angle from it, and of course emphasize those angles, which of course results in our century into slightly different modes of practice, but also understanding. But they overlap so much still nowadays that we can rely on the term mindfulness to say pretty much the same thing. So mindfulness is simply being present in the present moment in order to uncover the nature of our life, human life, but also more in general, how life works. So mindfulness is not the goal in the original teaching. Mindfulness is the means to develop wisdom, the means to an end, and the end is to reduce suffering. And by learning what it is made of, how to accept it, how to let it pass, because it does pass, and basically, the essence of mindfulness training is threefold. First, it is composed of concentrative practices. And again, different congregations of monks and nuns will teach that slightly differently. But basically, we learn to concentrate, to stay in the present. The second aspect is to learn not to react to whatever and identify to whatever we are encountering on the way. And the third is to learn compassion, to learn that because human beings do react and are not necessarily very aware of what are the mechanisms in their thinking and behaving and feeling, and especially reactivity, then of course we identify with phenomena, we identify with thoughts, we make them ours, mine. This is my thought because I think it, not realizing that not everything that comes from within is not necessarily mine. Otherwise, there's a lot of rubbish that comes out of ourselves, including in a bathroom. It doesn't make it necessarily mine or me. So by identifying with thoughts, identifying with emotions, and with behavior, then we suffer. We suffer for various reasons, but
So, so if I'm getting this right, mindfulness is a combination of being in the present moment and standing in witness rather than identifying with what's going on and then
yes,
choosing how to respond to it.
very much. Choosing how to respond to it is so important, but the choice must be wholesome. It must be based on reality, the reality that we observe, but also a basis of not creating suffering. So choosing to respond, yes, but in a way that is not either embracing existing suffering or creating more of it.
For yourself and others.
Yes, indeed.
Okay.
Indeed.
So, uh, what is the problem? Not problem, but why is it necessary or needed or focused on to stay present versus planning for the future or hashing out the past?
Mm, indeed, there is a nuance. We need to learn in life. We need to remember the past. We need to learn from it, of course. We need to plan in the future. This is very important. Otherwise, we become like a newborn baby. Yes, you perfectly in the present, but totally ineffective in life. So we have to do this, but because we choose so, or when we choose so, not because it spontaneously emerges in consciousness in a way that creates suffering. So when we meditate, when we practice mindfulness meditation, one of the things we learn is to focus, to anchor attention on the breath. So some prefer the rise and fall of the belly, depending on those congregations of monastics, and others prefers the original, focusing at the entrance of the nostrils, which is what we use in MiCBT. And we learn to concentrate so that thoughts that emerge are used as tools to learn three very important frontal lobe skills. We call them executive functions. First, the ability to notice thoughts and to notice them as thoughts. So sustain attention on the breath and hold in mind with working memory the fact that a thought is just a thought. It's just a mental event. We don't identify with it. A second is the ability to prevent the usual response, which is to identify with the thought and run with it. And the third is to switch attention back to the entrance of the nostril. So these three functions can then be used in daily life when unhelpful thoughts and emotions arise in consciousness. So when a depressive thought or an anxiogenic thought arises, we're able to practice those three skills. Noticing it's just a thought. Thanks, but no thanks. I don't need that thought right now, and it's not helpful. And switching attention back to the task at hand, whatever we do in daily life. So that's the first method of mindfulness training.
So if you're in a situation, and this is when the pavement and the rubber meet, right? You're in a situation. You're not laying down or sitting on your mat, and you still need to run through those things. So do you stop everything you're doing, take a deep breath, close your eyes, assume the position? How do you engage that in the moment?
Okay, so this is the importance of training. The importance of training lies in the fact that training does produce neuroplasticity, which means the ability of the brain to reorganize itself and connect neurons with frequency, high frequency of training in particular, and precise training so that we don't bark at the wrong tree. Yes, we really precisely train those neural networks where they need to be trained for the purpose you are evoking.
So I'm sorry, we're going to have to pick up on this on the other side of a station break, and we will pick up on it. Dr. Canyon and I will return very shortly, so don't you go away. This is Mission Evolution, www.missionevolution.org. Why are so many people anxious and depressed? With us this hour is Dr. Bruno Cayoun, the author of the Mindfulness Meditation Workbook for Anxiety and Depression. Um, Bruno, we were interrupted in the middle of a uh, answer to a question, and we had talked about how using this mindfulness in the moment in the day-to-day world, what does that look like? And you had started with talking about training, how it involves training. Would you take up from there, please?
Of course. So there are different, as I said, different emphases according to the types of teaching of mindfulness. There's a few, but this one is quite universal. So noticing a thought, and we do the same with emotion, noticing, not identifying with it, accepting it is there, but also accepting with a degree of wisdom. We know it is impermanent. We know it will pass. Yeah? And switching attention back to the task at hand. So in formal meditation, of course, you focus on the object of concentration, which may be the breath. In MiCBT, we also scan through the body. So we focus on different parts of the body. And again, observe without identifying with phenomena, so that every time an experience arises, whether mental or emotional, so through the body sensations, every time it arises, we learn not to identify with it. And this is very important because not identifying with it as a form of training prevents us to identify with it outside the training, which was really your question. How do we deal with life with this? Well, how practical is it? So when an unhelpful thought or a strong sensation in the body caused by that thought, which then we come to call an emotion, when they arise, if we are training, especially morning and evening, high frequency, training to not identify with these, then we are less likely to identify, at least not as strongly in daily life. And we're more at ease letting it pass.
So, do our thoughts that are causing problems here, okay, we're
Hmm.
about to respond from a
Hmm.
thought, and we have to take a breath and pull ourselves out of the thought, not identify with it, and take it from there. Are those thoughts very often from the past to start out with?
Okay, so in daily life, not necessarily. We respond to situations, just as now I'm responding to your question. This is not a thought of the past. Yeah. But when we meditate, they do come from the past. Unless we are engaging with them, running with them, then of course we are now creating more, we lying down more conditioning, more thoughts by identifying with it. But if you just observe the breath, the body being an anchor for your attention, just anchoring attention on the breath means the touch of the breath, the temperature change it creates on the skin. There is nothing cognitive about this. We're not thinking, we're feeling. But we notice very quickly, especially if we're not used to practice, that as we do so, thoughts begin to emerge. And you can pull out from a drawer what is not already there. Similarly, you can't have thoughts emerging spontaneously unless they've been laid down there already in the past. Even though it may be a thought about the future, it's still laid down in the past. So, for example, if this morning you were thinking of tomorrow's meeting, which you need to prepare for, then in your meditation tonight, you might have a flashback of this morning thought about tomorrow's meeting. So it's not that your thought is in the future, um, or even the present, is that the thought of this morning about tomorrow has emerged. So it's still the past, even though the topic may be differently allocated to the present or the future.
So, when you're meditating and these thoughts that come up, are you basically moving through them then and then are unencumbered by them in your day-to-day life? Is that the idea?
So the idea, of course, if there are problematic thoughts, then that is the case, yes. If if we ruminate during the day because of anxiety or depression, if we worry during the day because we tend to be worried, anxious, then yes, when they keep on re-emerging, the brain has learned through practice not to engage with them. So it's much easier to transfer a skill that we train with than to try to rationalize whether the content of the worry makes sense, should we worry or not, etc. So it's just a training. It's like going to the gym, if you like. Yeah.
So,
Except-
do you
Mhm.
build like subroutines, like in computer? In other words, by going through the meditation practice morning and evening, you're training yourself so that you can engage with it instantaneously rather than having to walk through a longer practice.
Do you mean during the meditation?
No, I mean, does setting up the practice of meditation, can that be then engaged as a compact unit by taking a deep breath before responding in day-to-day life?
Oh, definitely. Let's not underestimate the power of neuroplasticity. As you train to practice, naturally, reactivity decreases in daily life, naturally. And there's strong neurological evidence of this, dating since 2005 now.
Oh, what were the studies on that?
Oh, okay. There's so many, but the first and most exciting one, the one that made me look a bit crazy in the corridors of my psychology department, very excited with the paper in my hand, was published in the journal Neurons. And this was demonstrating that people who were meditating every day were having a brain that was very different to those who were just starting to meditate. Those who were meditated for, okay, that was the first study, 10,000 hours. Yes. So older adults, obviously, had a frontal lobe, especially the orbitofrontal cortex, the insular cortex. So orbitofrontal cortex, we manage stress, we make decisions, etc. We learn to also control attention. And then the insular cortex, we learn to feel sensations in the body so that we learn to detect early cues of distress, for example, and emotional experiences. And areas also of the top of the brain, which makes us, for example, more able to practice compassion. These three parts were significantly greater, bigger in volume, gray matter volume on MRI scans than those who did not practice very much, or those who were just novices. And the really marking element of this study is that it was comparing also older age with younger age. So those who were fairly young did not practice very long or were just starting, they were novices. Their brain in those areas was much or less voluminous than older adults in whom you're supposed to get a shrinkage of brain volume, not an increase. So their brains were so much more muscly in old age, in those parts of the brain, than those of their younger counterparts.
So the older age, but the people that had been meditating.
Yes, of course.
Okay. Okay. I was going
Yeah,
to say,
yeah.
oh, so now we have a cure for old age. I'm thinking I'm liking this, where this is
Yes, yes,
going.
yes, yes.
Yeah. Yeah.
Absolutely,
Yeah.
absolutely.
So we do tend to think that the brain size and the brain function decreases and deteriorates with age. But from what you're saying, actually, if you practice meditation, if you exercise, if you will, that part of your brain, that doesn't have to be the case. And are there consistent studies proving that part?
Definitely, but we have to be careful when we think of this. We're talking about the parts of the brain associated with the practice. So if you start playing piano and you play 10,000 hours of piano, your supplementary motor area and motor cortex will also increase. Doesn't matter what your age is. But it doesn't increase when you meditate. So the parts of the brain that are not involved in meditation do not increase. In fact, they decrease in old age. Yes. And those parts that are exercised every day not only remain strong, but they also increase. So that's quite
So
remarkable.
so to hold as much as you can, you would not only meditate, but you
Mm.
would exercise the other parts of your brain by
Oh yes,
staying active in different arenas.
indeed, you would.
Ah, interesting. Okay. Um, so why is it so hard, given that this has been around since forever? Why is it so hard to find peace in the modern world? Why aren't we using this?
Mm. There are several reasons. One of them is that we identify with the way we think and feel and therefore behave. So if I feel this way, therefore it is right. Yeah, if I think this way, since I am thinking it, therefore it makes it right. Yeah. And because of this identification, it's difficult to be flexible enough in our cognition, in our way of thinking, to listen to others, to consider others' point of view, to have that cognitive flexibility, which is so transformed when we meditate. Again, as I said, because we don't identify with thoughts that arise and pass. So we have this distance to consider other ways of thinking. But in our life, we suffer because of ignorance. We have no idea that this is not my thought, this is not my feeling, it's just a feeling that co-emerges with the thought I just produced. And of course, if we're not aware that we react because of these sensations in the body, because of these what we call emotions. Emotions is a compound, is not a unit. So sensations in the body are very strong element of emotions, and we react we behave in our life according to how we feel. If we learn not to identify with how we feel, then we're less likely to react. We're more likely to be proactive. And
Mhm.
proactive according to a way of thinking that is a little bit more considerate and less mine or me. I think this
Well,
way, therefore I should act this way.
it's time for a station break. Bruno and I will be right back to continue our discussion. So stay right there. This is Mission Evolution, www.missionevolution.org. Is psychotropic medication the only answer? This is Mission Evolution, missionevolution.org. With us discussing alternative treatment for anxiety and depression is Dr. Bruno Cayoun. His website, mindfulness.net.au. Um, Bruno, now I know, neither of us are doctors and we're not going to talk about prescribing drugs. But are there studies out there that show that the meditation and the mindfulness approach can be used in place of medications?
Definitely, there are. There's a big study that was done in the UK by a team at Oxford University that demonstrates that over 2 years, or it could be 2.5, I think it's about 2 years, medication didn't do better than meditation in preventing relapse in depression. It's very clear. The trends are pretty much the same across the 2 year period. So that's a good one because it's a longitudinal study.
So let me see if I get right what you were saying, that you could either medicate or you could meditate and they had the same results. And the
Um,
ones that were meditating were not medicated.
that's correct. Of
Okay.
course. So what the research shows, or even from the 1980s, cognitive behavior therapy was compared with non-medication, non-therapy, and medication alone, and and with medication as well. So what was interesting is that, and two studies were done, is that cognitive behavior therapy, even without mindfulness, was just as effective as cognitive behavior therapy with medication, and just as effective, even more effective than medication alone. Why? Because with medication alone, people relapse. There is no brain plasticity, there is no new insight, there is no skills, and the big um, the emphasis, I would say, of mindfulness-integrated cognitive behavior therapy. So this is the method we teach and implement, is that it produces neuroplasticity to prevent relapse, as well as developing wisdom, developing the skills that enable us to uncover the nature of our thoughts, feelings, and emotions,
So
and certainly the behaviors.
let's break this down a little bit.
Mhm.
I'm trying to get a picture of how meditation does this. How does it do that? How does it work with our emotions and our memories and our responses?
So here we talk about mechanism. So when we begin mindfulness of breath, which I explained already a little bit earlier,
Hmm.
we learn to deal with thoughts. Yes. Okay.
Okay.
And then in MICBT, Mindfulness Integrated Cognitive Behavior Therapy, after a couple of weeks of practicing mindfulness of breath, we move to scanning the body, feeling sensations in the body, learning not to react and not to identify with them, and then and moving through the entire body that way. And we do that in different ways across time. So if I ask you, Gwilda, how do you know when you feel anxious, for example, or fearful? Sometimes there are fears. How do you know that you're feeling it?
It would be for me personally. I'm a little more kinesthetic. It would be something in my body. My stomach would be tight,
Well,
something
that's
like
the
that.
only way to feel things, even if people are not kinesthetic. Otherwise, they're thinking it, yes?
Hmm.
But if
Hmm.
we feel, then we have to feel it somewhere. The only place is this body. So it's the same with anger. We feel heat, we feel agitation. With sadness, we feel down, we feel heavy. With joy, we feel light. With cravings, we have other type of sensations, and so on and so forth. So now imagine that when we practice the meditation of on body sensations, it's called Vedana Nupassana in the traditional Pali language. We call it body scanning here in the West. But if we learn to feel, accept unconditionally what we feel, and move to the adjacent part, feel it again, accept it unconditionally, and move this way through the entire body from head to feet and back to the top of the head, systematically learning to feel, accept, and move so that progressively all sensations in the body become acceptable.
Oh,
Given that emotions are made of sensations in the body, what do you think will happen when all sensations become acceptable?
the
Emo-
emotions will follow.
Emotions become acceptable. And when they become acceptable, we learn to feel them, let them pass. We don't need to react because of them. So in daily life, suffering is reduced automatically just because of that. We don't need to be as reactive. And we're more able to accept what we feel. It doesn't matter whether we constructed it with our own thoughts or someone is being a bit rude or offensive or we don't like a politician on TV, because that will create a spike and we've learned to accept it. We let it pass. So it makes us more active, less reactive.
So, without sans meditation and mindfulness, we're kind of like this ball of experience that we haven't processed.
Mm.
Because when we run into one of those places of feeling, it feels unpleasant, so we go away from it rather than move through it. Is this what we're doing here?
Uh, what we're doing here is really learning not to identify with any experiences that arise in consciousness. It doesn't mean that they're not there. It just means that they are spontaneously arising or that we have co created that in our way of thinking. So, for example, if someone is saying something that is a little perhaps offensive or creates a bit more anxiety, that will co-emerge with sensations in the body that we not identify. I repeat, this is so important, that we don't identify with. We don't throw it away. We don't negate it. We don't say it's not important. We just say, I'm not going to react to this because my judgment of the stimulus, my evaluation of the world, or my evaluation of me is creating this. I'm responsible for how I feel. And therefore, I don't have to react to this to be able to process information in a good way, in a wholesome way.
So then, as you continue to do this morning and evening, you become increasingly less cluttered, um,
Yes,
and um, and it becomes easier to do in the moment.
pretty much. Easier and easier because the brain changes in the meantime. Remember, we are training. It's not just an understanding that we're teaching here. The understanding everybody can open a book and get this very quickly, but it doesn't mean that they're less angry with the kids or less likely to drink alcohol to decrease anxiety. Reading on scriptures is wonderful. It's a good vehicle. But unless there is practice, the brain doesn't change and nothing much change that doesn't change in behavior. Yeah.
So, have you seen a reduction in the use of psychotropic drugs among the people that you've worked with and taught this skill to?
Psychotropic medications are very important. We can't dismiss them as useless or bad as such. The question is, what is the long-term effect? Is it good? Does the brain habituate and then it becomes back to our own old habits? So as soon as the brain will habituate to anything, including mindfulness practice. So why? Because it produces neuroplasticity according to what you teach it. Um, Again, the problem with psychotropic drugs only if they are used in conjunction with therapy, I believe this can be an advantage. It depends. I mean, it can save lives. People who are very intensely suicidal, um, I think they better be medicated, at least in some cases. And it doesn't mean that medication will prevent them to take their life either. But on the whole, on the whole, I believe we are better off with than without in severe cases of mental health problems. If they are more the middle of the road, the two standard deviations above and below the mean, if you like, the 95% of cases, I think if people meditate every day, they they move on in life. They learn not to identify with depressogenic and anxiogenic thoughts. And this was demonstrated in the year 2000 twice in two studies by colleagues in the UK, both in Oxford and University of Wales, where it was very clear that people who were examined with treatment as usual were compared to people who were practicing mindfulness meditation plus treatment as usual, and we've done loads of studies ourselves, were clearly advantaged. They were, with meditation, relapsing significantly less often. So about 34 or 35% of people with depression were not relapsing with meditation added to their normal treatment. So that's quite significant.
So basically, you can use psychotropic drugs like a cast. You break a leg, you're not going to walk on it. You cast it to stabilize it, but then you have to do physical therapy and exercise and training, and
Beautifully said.
the mindfulness is that the exercise and
Beautiful,
the training.
beautiful. And also, don't forget, you can hurt your leg without needing a cast.
You can hurt your leg without even noticing it,
Yeah, well, that's right.
depending on how much
And you can,
distraction we have. Yeah.
even better, you can walk mindfully and don't break your leg. You know, that's the
I
idea.
like
Yeah,
it.
yeah.
I like it. That's the way to
Mm.
go. Preventative medicine, right? So we're about out of time on this segment, but when we return, I'd like to go a little bit more into neuroplasticity and how this applies with meditation. So stay with us as Bruno and I continue our journey towards peace in turbulent times. This is Mission Evolution, www.missionevolution.org. Can one create neuroplasticity? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Bruno Cayoun. His website, mindfulness.net.au. As promised, let's go a little bit deeper into neuroplasticity. Um, eh, there's a certain amount of neuroplasticity I understand that happens whether we're consciously working with it or not.
Oh, definitely. Whatever we do habitually strengthen neural connections. And according to the doing, it strengthens it in certain sides of the brain. So, for example, if you play piano and you play piano every day, you'll have this related part of the brain thicker in terms of gray matter volume than if you did not. With obsessive compulsive disorder, for example, there's clear evidence of increased gray matter volume in the striatum part of the brain, which is associated with automaticity, and so on and so forth. So if we are depressed and depressed more days than not, then the amygdala, and that applies to anxiety even more so, the amygdala is clearly bigger than if you're not depressed or anxious, because it means you're less reactive. So there was a study, a fascinating study of orphans in Eastern Europe and Asia combined in orphanages. And this study demonstrated very clearly that when children were scanned, they were given an MRI scan at the age of 9. Some had significantly greater amygdala volume, almost twice the size. The amygdala is the almond-shaped gland in the center of the brain responsible for our reactivity, right? Emotional reactivity. So fear, anger, etc. So this part of the brain was significantly greater than some other children who had been in the same orphanages all their life. So the researchers scratched their head because um, they couldn't understand why. So they looked at the age of adoption. And what was fascinating was that when the children were adopted at um, 5 months plus minus one compared to 15 months plus minus one. This is what made the difference. The children that were adopted at 15 months had the amygdala at 9 years of age, so 8 years later, twice the size than the children who had been still at 9 years of age, than the children who had been adopted at 5 months. So they rationalized that during that first year, they must have been more neglected or abused, or somehow that year was much, much more distressing than for the other children. And they all were raised with nuns, basically, and the same ones. So that was not an effect to be considered. It was really the age of adoption. So of course, when they grow up with a bigger amygdala, you can imagine how more fearful, aggressive, and so on they may be. And children who have trauma in early childhood is been demonstrated since many times, run in much more troubles with mental health later on in life.
Yeah, they call that adverse childhood.
Mm,
There's another word, adverse childhood trauma or something. And it's a thing that people are,
it is.
if they have adverse things in their childhood, it tends to bubble to the surface of the rest of their
Mm,
lives. That being the case, can we unbuild the
yes.
neuroplasticity that
Yeah,
is undesirable?
absolutely. And a lot of people come and see us for this, complex trauma, personality disorders that come from trauma in childhood, which change the trajectory of personality development, come to therapy often for that, not just to us, but all therapists. Um, and what's fascinating here is how rapid the change can be observed, and how shocking it is for people to observe that they can change so quickly and they've never learned that before. They've really understand. I remember this lady that was a bit different. She had generalized anxiety disorder, which of course came from early age obsessive compulsive disorder. But she had developed chronic pain, like many do, and her pain was decreasing so quickly that she burst in tears
Mm.
in one of the sessions. And when I asked, well, why are you sad? You should be happy. She said, I've been 20 years feeling the way I do, and no one ever taught me how easy it could be. And I reminded her that perhaps it's understandable, but perhaps gratitude is a good way of replacing sadness. Yeah. Because it's good. Some people will never get those techniques.
So it's the time in the show, Bruno, when I get to ask you, what's your mission?
Oh, actually, my mission since I was 10 was to fix my mom, who was depressed all the time and hospitalized. And I didn't understand. I thought she was ill.
Mm,
So
mhm.
I wanted to be a doctor to fix my mom. That was. And yeah, I didn't understand the psychiatric condition versus physical conditions. And slowly, so I departed from this aim, which I thought was just a childhood aim. And eventually, discovering mindfulness meditation, it brought me back on this track of thinking how much it had changed me. I was very strongly motivated to move into mainstream psychology. I was more into alternative methods in the past and all sorts, and wanted to bring mindfulness meditation to mainstream psychology, which I did. And my mission, if you like, is to decrease suffering locally, globally, the best way I can.
Well, God bless you for doing it.
Thank you.
Can mindfulness meditation be used to cultivate spirituality?
Definitely. But again, it depends on who teaches it, what method they use. Is it the traditional method, or is it just being in the present moment, which is nothing to do with MICBT, what we're teaching here, where we use the traditional teachings, which of course aims at developing wisdom. And any wisdom tradition that does not include compassion and love is not accurate. It just doesn't work. It won't work. Why? Because it's very simple. Wisdom is a testimony of compassion, and vice versa. Compassion is a testimony of wisdom. You can't be wise unless you develop compassion because you understand how things work. I'm not Christian, but I understand very, very clearly someone who on the cross says, "Forgive them, Father, for they don't know what they're doing." It is true, there is ignorance and reactivity. Once wisdom is established, there's far less need to react and to react in a selfish way. And so when we go back to mindfulness in relation to your question, what is spirituality? Okay, there's faith. What else is there? What is it made of? Again, mindfulness can serve to examine our own spirituality. Whatever the orientation is, it's not the point. It's what is it made of? It, if I say, what are you made of? That's the very basic question. We will say, my thoughts, my feelings, my body, my, I, me. When we meditate, when a thought arises, we don't identify with it. It arises, it passes. This macro bit of me, we have let go of. And then a sensation arises. We observe it. It can convey a sort of emotional tone. We call it a hedonic tone. It arises, it passes because we don't identify with it, we don't react with it, and so on and so forth. We know that the body arises and passes too. I mean, look at this balding head. I mean, this is not, come overnight. Every moment is a moment of change. So we understand the impermanence of phenomena, thoughts, emotions, body, even behavior. So when we understand, well, okay, well, what is the self then? Where is this me? That I call, I'm a Christian, I'm a Muslim, I'm a Jew, I'm a Buddhist, I'm anything. The I am becomes questioned because this I passes away too. So when you let go of that ego, that sense of I, in Italian, ego, yeah, means I, me, in Latin. And so when this I is not so fixed and strong and we don't attach ourselves to it, what is left is others and nature. And if you want to put God, that's fine. But the ego passes away. So the shorter, the less strong and solidified is the sense of self, and the more there is place for spirituality.
So the less identified we are with anything that hangs the I off of it, that's ownership, the more available we are for everything.
Yes, indeed. And the belief of others, the view of others is more considered kindly. And the mishaps of others, the ignorance of others, and our own are considered more in terms of unknowing, being unaware rather than being nasty or being selfish, ill-willed. It's just unawareness. It's just we don't know we identify with phenomena. So yes, forgive them for they don't know what they do. Indeed, indeed.
Unfortunately, that is a good place to stop, but we are out of time. Bruno, thank you so much for coming on the show.
It was a pleasure. Thank you for the opportunity.
Our guest this hour has been Dr. Bruno Cayoun, author of the Mindfulness and Meditation Workbook for Anxiety and Depression. To find out more about Dr. Cayoun, where you can find his books and all he has to offer, visit his website, mindfulness.net.au. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. Be sure to join us right here next time. This mission will continue, bringing information, resources, and support to our evolving world.